During the 70s, and during the civil rights era, there were a number of physicians who made themselves available to administer to the needs, the medical needs of many of the civil rights workers and those who are allied with them, particularly where it came to confrontations with police and other hostile elements in our society during that time. And it was early in 1970 when I was called, and I'm not sure exactly who called me, but I was called and notified or requested to see Lee Berry, who was at that time a patient in the prison ward at Bellevue Hospital. I was told that he was ill and that he would, or his attorney had requested additional medical consultation for him. I went down to see him, and that was the first time I met him. At the time I first saw him, he was one day post-operative for a procedure which was designed to interrupt his venous flow from his left leg to the central part of his body, the central venous cava, because he had thrown an embolus, or it was suspected that he had thrown an embolus to his lung. And he was septic and very ill. He's febrile and very ill. The latest story that I was able to construct was that he had been a patient at the Veterans Hospital in Manhattan subsequent to his suffering from epilepsy, epileptiform seizures, which he had developed while he was in the service in Germany, while he was in military service. He had been treated for this condition, and but there were times when it became more severe, and from time to time he had to be admitted to the veterans' hospitals. This was after he was discharged from the service. He was admitted to the veterans' hospitals for adjustment of his medication and for stabilization of his seizure disorder. And it was during one of these periods of hospitalization that evidently he was arrested while a patient in the hospital, taken from the hospital to the Tombs, and there he was incarcerated, as I understand it, for a number of weeks under very negative and brutal circumstances. He developed what appeared to be an acute abdomen while a patient in the Tombs, with symptoms severe enough to require his admission to Bellevue Hospital as a prisoner. And it was, as my understanding, that while there, he was operated on. He had an abdominal operation for his abdominal symptoms. An appendectomy was done, but it was the finding that the appendectomy did not show severe appendiceal pathology, but he continued to be ill, febrile, and there may have been a period when he was also at Rikers Island, but I don't have that sequence clearly in mind at this moment. But he was again returned to Bellevue Hospital when he did not improve, and at that time he developed what appeared to be a pneumonia and a lung abscess in his right lower lung field, which was later determined to be the sequence of a septic embolus from his leg, from his left iliofemoral vein. And that was the operation that he had in late December of either 69 or into 70, where I was called to see him because he was seriously ill and in intensive care. I consulted with his physicians, and it was decided to put him on antibiotics, massive doses of antibiotics, anticoagulant medication, and fluid and other supportive treatment, bronchoscopy and postural drainage of his lung abscess. He was coughing up blood and pus at that time from the abscess, which originated as a septic embolus in his lung. After that period, it seems that legally he was separated. I think he was, again, a period when he was in Rikers Island, and I visited him also at Rikers Island as a consultant on several occasions. And then when his case was separated, he was moved from Rikers Island to my private service at Mother Cabrini Hospital, or Columbus Hospital as it used to be called, on 19th Street, downtown Manhattan. And I took care of him as a patient there. His diagnosis was septic embolization with lung abscess, elephantiasis, swelling, chronic swelling of his left lower extremity subsequent to the ligation of his common iliac vein at the time of surgery in late December of 1969. Well, my information is that he was first brutalized when he was in the Tombs. They did not give him his normal medication. In fact, I think they took his medication feeling it was some kind of contraband, and they didn't give him his medication. And they brutalized him. I understand they lacerated his scalp, they kept him in solitary, they kept him on tea and bread. But I was not aware. That was before I had even seen him the first time. That was when he was first arrested and taken from the Veterans Hospital. This was information that I subsequently got after I had taken him on as a patient. Now, after he got into the prison ward at Bellevue, he was restrained, and you know, his general treatment was very rough, and certainly did not improve his general medical condition. Whether this, I'm not sure how this continued when he was on Rikers Island, but he was in a prison circumstance, and my information is that he was brutalized during this period. Now, when he came under my own command and on my responsibility, and we moved him to Columbus Hospital, he was no longer a prisoner. He was my patient, and of course, he was not brutalized under those circumstances, but he was seriously ill. He was septic. We had to treat him very intensively to control his condition. And that's about as best I can inform you as to what my knowledge of his management by the police. Well, it happened that I graduated from medical school at NYU and Bellevue, and I knew some of the senior staff there. I knew them from my student days. And so they were courteous to me. They knew me personally. But these were not the doctors who were immediately taking care of him. He was taken care of essentially by the house staff under their supervision. So when I went in there as a consultant, after I had gotten legal consent by a judge and permission to go in and have access to his medical records and to him as a patient, members of the senior staff were courteous enough to talk to me and interact with me and to accompany me when I went to see him as a patient at Bellevue, at least on the initial occasion. I went several times, but on the initial occasions, they did that. And so I was offered at least reasonable courtesy by the staff at Bellevue Hospital. Imperato, I remember Dr. Imperato was one of those who saw me initially, and he was a senior staff member at Bellevue Hospital on surgery. And so I was accorded reasonable courtesy, I would have to say. They didn't prevent me from seeing him once the legal clearances were made to permit me to see him as a consultant. And the same at Rikers Island. I had clearances to see him at Rikers Island, and they admitted me, and they accompanied me to see him at his bedside and whatnot. And it was a rigid disciplinary circumstance, but it was courteous. It was courteous, at least to me personally, as a physician. At the time, of course, he had been in the Tombs for a number of weeks, number one. He was inadequately alimented there. His normal drugs were taken away from him, and so he started having seizures again, to which proper attention and medical supervision was not given when he was at the Tombs. He lost weight, and when I first saw him at Bellevue, he was thin. He was a gangly, tall little fellow, but he was very thin and evidently malnourished. And when they started medicating him, of course, this medication for his seizure disorder blunted his consciousness, and he was sort of drowsy and semi-confused, and he was obviously in pain. So I would say his general medical circumstance was not good, you know. It was very challenging. And that was the point when I gave opinions as to what could be done, and some of those opinions were respected. And together, Imperato and I and the senior staff there, some of the senior members of staff, decided that he should be on anticoagulant medication, he should have medication for pain, he should have medication for his seizure disorder, and he should have fluids and proper intravenous fluids and proper food. And he started getting that then. Now, whether that was interrupted while he was at Rikers Island, I'm not sure. But he really didn't improve a great deal at Rikers Island, because that was what necessitated, finally, when he was separated, his case was separated, they're releasing him to my care as his personal physician. And that was when he was moved to Columbus Hospital. And then thereafter, I treated him at Columbus, I treated him later at Jamaica Hospital, I treated him at the Carter Center and in my private office in Queens. I became interested in thoracic surgery, chest surgery, when I was a resident at Harlem Hospital. That was between 1947 and 1952. During that time, one of my colleagues, an M.L. Niclario, and I, we were full of vig and pep and everything. We were young. And we did all kind of trauma, particularly chest trauma. And we had a great experience in doing chest wounds, particularly heart wounds. And I became interested enough. We used to come in at all hours of the day or night doing these cases. Sometimes we would do more than one a day of actual stab wounds of the heart. And we wrote a paper. Dr. Maynard got credit for the paper. We did most of the legwork for the paper. Dr. Maynard was the chief of surgery. But we reported 82 cases of stab wounds of the heart that we had done and had recorded at Harlem Hospital. We didn't do them all, but we did about a third of those ourselves personally. We took movies of some of the cases while surgery was going on. But when I finished my residency in 1952 and got my boards in general surgery, I wanted to get my boards in thoracic surgery, cardiothoracic surgery. At that time, Columbia University was initiating a negotiation to become affiliated with Harlem, or Harlem could be affiliated with Columbia. And I requested training, additional training in cardiothoracic that would be possible, not at Harlem, it would be possible at Columbia. But the chief of surgery at Columbia at the time could not get me into their schedule for training for approximately 3 years. And so I had an additional opportunity through Dr. Maynard and others to go to France, to Paris, at a thoracic surgical hospital in Paris, the Hôpital Broussais. And I spent a year there. My wife and I and my kids. We all went to France for a year. And I saw all kind of surgery, particularly cardiac surgery at the Hospital Broussais, and came back. And I was able at that time to get a residency in cardiothoracic surgery at Downstate Medical Center under Clarence Dennis, who was from the University of Minnesota, and he was the professor of surgery at that time. And he was one of the initiators of open heart surgery procedures. And I spent 2 years at Downstate doing my residency in cardiothoracic surgery. That brought me up to 1958. And in July of 1958, I went back to Harlem as a thoracic surgeon. So I'd been at Harlem between July 1st of 1958 and the time Martin Luther King came in. That was about 6 weeks later. In other words, it was July, August, September, about 10 weeks later, that we had occasion to treat him as an emergency case at Harlem Hospital. I was one of the surgeons. I won't say that I saved his life personally. I won't say that, but I would say this, that with my training, it was as though my whole life had been dedicated to be ready for that moment. And we were able to remove what was actually a letter opener made out of steel that had penetrated his chest bone here, his sternum. It had gone through his sternum and lodged right at his aorta where the subclavian or the innominate artery came off the aorta. It didn't penetrate either one, but it was lying right in the quatch, and it might easily have killed him if it had been just a quarter inch in either other direction. We opened his chest and were able to ascertain where that weapon was, where it had penetrated to, and we were able to remove it. He convalesced in a proper fashion. There was a whole lot of brouhaha about, who did the operation, and I didn't really like to get into that because we saved his life. That was the important thing. And Dr. Maynard, as chairman of the department, of course, led the description of how it was done and this and that, although he came in after Niclario and I had really defined the pathology. In fact, we backed away so that he could actually pull the knife out, so that we made a proper sequence and a proper respectful gesture to our chief. I've befriended King and also his wife, who was there the next day, and we had a nice relationship while he convalesced in New York. I did not actually interact with Dr. King after he left New York, although he did write me a letter, which I have a copy. There was one photograph made in the operating room while we were operating. And I have that picture in my office at home. And it could be available if you need that for any reason. I can get that for you. And we have some other pictures that dealt with that particular episode at Harlem. As a matter of fact, the pavilion was renamed the King Pavilion, the Martin Luther King Pavilion. The new part of Harlem Hospital is the Martin Luther King Pavilion. I left Harlem Hospital to assume my own private practice in 1967. And I had an office in Harlem. I had another office in Queens, where I live now. And so that's pretty much the story. We were badly traumatized, of course, when he was assassinated. It was the only time I really cried. And witnessing his funeral on TV, I couldn't contain myself because he was such a beautiful man, And so that's the story. That's how I knew Martin Luther King. I first knew Rap Brown back in 1967 when I left Harlem because there was a riot in Newark that summer. And I think the Panthers were active, and there was a new political party that met in Chicago that summer. You could probably find it in your records. And my daughter and I, the daughter who's here with me today, and I went out to Chicago just so we could observe what was going on and be a part of it. And I remember Rap Brown with his bodyguards and everything came in and spoke. And it was just one of these things that was just dramatic, you know, and to the extreme. I didn't have him as a patient until later. He became involved in some kind of shootout in Harlem. And I forget exactly what year that was, but he was arrested and he received a number of bullet wounds himself. And he was at Roosevelt Hospital. That's where he was hospitalized initially. And again, they called me, and I'm not sure who it was. I don't think it was Lefrak. But anyhow, I was called. And they had to give me special permission, the police department, to go down to Roosevelt Hospital because I was not on the staff there. And I had to elbow my way through what appeared to be dozens of policemen just to get to his room. And he was there, and he again was septic and ill, and he had an epididymitis. And the question was whether or not he should have an orchiectomy, because that was standard treatment for septic epididymitis and orchitis in those days. And it got to be one of these things. Should we cut his balls off or not? You know, in other words, here's a guy who represented the ultimate of manhood, I guess, for blacks. And I had to make a decision, or come to a decision of whether or not I would concur to have that done. Of course, there was another physician that I called on, a urologist by the name of Harold Garnes. And he was chief of urology at Harlem at the time and at Jamaica Hospital. And I called Harold, and we went down there together the following morning. And we decided that we were going to use the most intensive type of antibiotic treatment. We were not going to operate on him. We were going to see whether he could weather this infection. And he gradually did. Yeah. After that, he was transferred to the prison ward at Bellevue because I knew the chief of surgery at Roosevelt, a white fellow who lived up in Connecticut. In fact, we took the board at the same time for general surgery. And he was not very courteous to me. He said, Cordice, I want you to get that prisoner the hell out of my hospital as soon as possible. And of course, he's the chief of surgery down there, and we moved him to Bellevue. The police wanted to do it anyway. And so I visited him at Bellevue Hospital. And it was essentially the same circumstance that we used with Lee Berry here. It was intensively observed and so forth. Then he was moved to Rikers Island, and I continued to visit him there. Then they moved him to Sing Sing. I think they took him upstate to Sing Sing. But every month, they would bring him back to Queens, to one of the police units down there in Queens, where Harold Garnes and I could re-examine him. And that happened every month for about 4 or 5 months. So they did respect our responsibility to oversee his medical care. I was never very friendly with him. He was like a self-contained time bomb. He was angry. He was not very communicative with me, although he respected me. And I met his wife, who was actually a lovely woman. And then I heard, after he got out of Sing Sing, we saw him together for about a year. And then I heard that he was in Atlanta, and that he was a Muslim, of course, and he had a mosque or some type of religious organization down there in Atlanta. And then I heard maybe about 3 or 4 years ago, or maybe longer, I don't know exactly, but they say he had been arrested again and put into prison in Georgia, where, as far as I know, he still remains. And so that is my interaction with Rap Brown. Circumstances arose where my medical talents were useful to the civil rights activity. I let it be known that I was available, and I was available. There were other instances which don't immediately come to mind, but I saw a number of civil rights marches in my office. Who was the one who married Marion McKeema? He was one of my patients for a short period of time. Oh, he went back to Africa and whatnot. But anyhow, I don't remember his name at the moment. But he was one of several civil rights people of stature who I had occasion to relate to as a treating or supervising physician. The details of the Physician for Human Rights, I don't know. I guess I belonged to the organization. I don't really remember that detail, but I knew some of the physicians who were active with them, and I was active with them. I was quite friendly with an operating room nurse, as a matter of fact, at Kings County Hospital, she was white, but we became quite friendly, and she was definitely pro-civil rights. She was an Irish-German girl, and she went on the marches. As a matter of fact, I let it be known that if she was arrested, that I would give her bail. In fact, I did send her money from time to time so that she could take care of herself under those circumstances. And there were other people that I gave money to, or I contributed money to see that they got essentials. And I wasn't the only one. A lot of people did that here in New York. I don't remember specific fundraisers, but there were examples where we were able to use our resources to help out in these efforts, you know? And that's about, you know, all I can tell you about that. But it was a very, very challenging time, and it was a time to which we were very dedicated, as professionals and as people. I can tell you this, I can tell you over the years, the racism in our society is still present. It's still present. It has been perhaps softened a bit. And I think the white population has become somewhat more sophisticated and somewhat more accepting of the need to recognize the humanity of blacks and Hispanics and everybody, for that matter, Muslims of other stripe. And I'm glad that I have lived long enough to see that there is a so-called black man. He's not really black. He's a human being, be considered by the electorate as a serious candidate for the presidency of the United States. And that has been a signal event in my long life. And I'm going to be 89 years old tomorrow. And I really appreciate that. And I would like to make that expression a part of your record.